Hi, my name is Gary. Today I shall present on artificial intelligence in healthcare, opportunities and challenges for the patient-doctor relationship. So I have divided my content into background, opportunities, challenges. We talk a bit about the doctor-patient relationship, and then we conclude. A bit about myself. I'm a medical doctor. I graduated in 2006. I went on to do a master's in public health. I also have diplomas in family medicine, mental health, family practice dermatology. Currently, I'm a Nanyang Fellows MBA program candidate. I expect to complete in July 2024. Beyond that, I decided to do a PhD, a part-time PhD in AI in healthcare. My current role in my company, National Healthcare Group, is that of a health service researcher, doing research on diabetes and complication of diabetes, as well as workplace health. I also see patients once a week at Woodlands Polyclinic. Please connect with me if you're interested. Opportunities. So you can see here from the AI in Healthcare Guidelines that was published in October 2021 by MOH, Ministry of Health. We can see that opportunities arises in many cases. Beyond healthcare, there's also wellness as well as indirect patient care. But focus of today's presentation, I shall focus only on patients' interactions. So let's start off with precision medicine. With precision medicine, we are able to improve diagnostic accuracy based on patient's individual profile. We can also recommend based on the patient's characteristics, such that we call this personalized treatment recommendations. And with monitoring of patients at home, we can even have consider this thing called hospitals without walls. So we can have patients that is having 24 hours on 7 wireless monitoring, so that we can better take care of patients and detect whether the patient will deteriorate, so that active intervention can be done. Next, we move on to challenges. So the main challenges we have in terms of patient-doctor relationship is that the erosion of doctor-patient bond. There may be a loss of accountability if the clinicians thinks that it's the AI that's making its decision. We'll talk more about that. There may be also reduced perceived empathy, such as a chatbot, because I think most patients actually want to speak to humans. Although there are some studies to show that ChatGPT can deliver responses that are actually more empathetic compared to humans. And what is more concerned is the risk of de-skilling medical professionals. If we over-rely on algorithms, what happens if there are some biases inside? What happens if there is a data shift? Do we still rely on this biasness? And how can we not de-skill our healthcare professionals? This is the picture I really like. It's a painting by Samuel Luke Flinders. It's on the doctor. So here you can see a doctor being present, looking at the patient. In this case, is a young child. Well, how many of you have seen a doctor and you realize that the doctor is busy typing, the doctor is busy documenting, and has very little time to actually look at you, but instead is looking at the computer. The importance of being present cannot be overemphasized. AI is able to automate routine tasks such as clinical documentation. There are some instances of Microsoft with Dragon Nuance AI. So the whole consult can be summarized by the ambient AI, such that they can actually reduce the need for the doctor's document. This will allow doctors to allocate more time for meaningful interaction with patients. And with improved communication, this may lead to better shared decision making. A lot of time in healthcare, it's not a simple decision of whether to go for procedures or not, because there are risks and benefits. And if there's time is needed to explain to the patient why the procedure is needed, what are the alternatives, and whether this is the best treatment for the patient. Next, we move on to the evolving role of doctors. With technology, with AI, what is the role of a doctor in the next 10 years? There's some thinking that, for example, doctors that doesn't rely on their hands, for example, procedurists, they may cease to exist or have a smaller role. I have a rather more optimistic view on this. I think that we have to navigate the sea of information with or without AI. So probably the doctor who is more comfortable using AI will probably outperform the ones who are not. Artificial intelligence can act as a co-pilot, complementing clinical judgment, especially the blind spots of doctors. For example, if the doctor thinks the X-ray is normal, or the CT scans or the scans are all normal, they can ask the AI to do a second check. This is by no means questioning the doctor's judgment, but just in case the doctor may miss something, this will allow the AI to alert and ask the doctor, do you want to relook into the X-ray, to look at the test? This reminder really helps doctors prevent mistakes, because as all you know, doctors are not perfect, and doctors do make mistakes if they're tired or they overlook it. We also need to ethically address the patient concerns. And finally, the responsibility lies still with the doctors, not artificial intelligence, and definitely not the computer engineers or the designer of the system. Finally, the conclusion is that there's a complex interplay of opportunities and challenges in the use of AI in healthcare. The potential of AI to enhance engagement as well as communication. And finally, how can the doctors harness AI while maintaining the human connection? Thank you for listening.